This segment is sponsored by iChiro Clinics. Sometimes when you're struggling with pain and you feel like you've tried everything, it can get pretty desperate, the search for answers. Dr. Michael Kwast is the founder of iChiro Clinics, and he joins us now to talk about your odds of success when you're feeling all that desperation, Dr. Kwast. It can be a real drag.
Yeah, for sure. When people are hurting and having problems, one of the things we discovered years ago was that by combining all of the different therapies, lifestyle, and different things that people can do, by combining those together, patients have the best odds of success of achieving their goals of restoring their mobility and function, which then lessens their symptoms so that they're not hurting and having problems.
Yeah, because you said to me, sometimes people will come to you and they will say, I tried, the vitamin potions. I tried this, and they do it chunk, chunk, chunk. And your thinking is, let's put those together, those chunks, and get better outcomes.
Yeah, exactly. So a lot of times, something will help like a little bit, but it's not really enough that you like notice. So you're not like, oh, wow, that was, because it's just a little bit. So sometimes people will try that thing, whatever it is, whether it's going to a chiropractor, doing exercises, a gym, a medication, vitamins, PT, whatever it is that they've tried, right? And it didn't work or it didn't help, but maybe it helped a little bit and they just didn't know. When you take those things and you put another little bit, so maybe you tried massage and it didn't work, but it did a little, it's going to do something, right? Positive. And then you take chiropractic and you put that on top of that. Now you've got a lot more help that you just created. And then you do a nutrition thing and an exercise thing and a PT thing. And you start putting all these things together, and all of a sudden these synergize together, and you see people get really fantastic results that they never would have achieved if they had just done these things singly or individually.
Mm. Sometimes people are resistant. Do you feel like you're constantly having to, well, I know you feel like you're constantly having to talk about the importance of chiropractic care as one of those bits?
Yeah, so there's just so much misinformation out there. I literally 25 years of doing this have never met a person yet who really even understands what chiropractic is. And that includes nurses and doctors. I took our technology that we use, I have taken that to over 100 medical clinics in Grand Rapids,
Wow.
and not one doctor was even aware of it. So there's just a lot of misinformation. And then, obviously you have chiropractors who are crazy, and then you have ones that are on the other extreme of very conservative, and everybody in the middle, and nobody's the same. So it's like people have these experiences and then they want to apply that to the entire profession. And that's just not even a realistic thing to do. You can't do that with anything, but for some reason that happens. So, trying to just educate people on the common sense of the stuff that we're talking about and recommending is the best approach. You do the safe, natural things first. If we can't get it done, you can always go do more, aggressive and risky procedures that are out there. But for non-life threatening things, I always recommend people, hey, let's try some stuff and see what happens. And a lot of times we get fantastic results with that and can help people with their quality of life.
Yeah, I was just going to say the ability to return to some semblance of normalcy is a game changer. And if you can do that by combining all of these different things, why wouldn't you give it a try?
Yeah, we see it all the time. We just had a 80-year-old come in. He has bilateral knee problems. So both knees hurt and have problems. He has bone on bone. They wanted to do a knee replacement. And I said, well, you can, but you're 80. The odds of that like not turning out good, just a surgery is like high. It's going to take a long time to heal. I go, why don't you just try doing some therapy first and see what happens? Worst case is you're going to move better. Oh, gee, like that's bad. That's a great thing, right? So we did that with him. And in 3 months, he's feeling great. He has no more knee pain. He still has bone on bone, but he has no knee pain, right? So we've bought him time so that he didn't have to have something drastic done, and it saved him money, and his quality of life is so much better. So there's lots of options people just aren't aware of.
All right. Well, folks, you can make an appointment at iChiro and find out your options. Visit their website, ichiroclinics.com. Thanks, Dr. Kwast.
Thank you.